Well, you're front and center, Pink.
Yes, Senator, I was wondering why the push for a public plan, a single-payer plan, when obviously the public seems very much against it. And if that's the case, sir, and that's the only problem, why not just drop it?
Will you let her ask her question, please?
Why not?
Let's be generous and kind to one another. She has a legitimate question, and I will try to answer it as best I can.
Sir, you are correct. There are a lot of people scared out there. However, the bone of contention seems the public plan. Reform is great. Reform is excellent. However, common sense reform is important. I think a lot of people agree that capitalism is the best way to regulate insurance companies.
I guess I don't.
I'm an independent.
By saying if capitalism, whatever that means, in its broad context. If it is the best way to regulate, then why do we spend more than any other country in the world? And why are we 37th in terms of our health status? That's what's happening right now. Insurance companies are overcharging. The pharmaceutical companies are overcharging. And again, you don't have to take my word for it. I was just looking up the other day. I didn't write it all down here, but I got some of them.
Do you think they should make a profit?
Just let him
Do you think
answer.
they should make a profit?
Let the man answer.
Well, I think insurance companies should make a profit in some aspect of it. Sure, I think they should. But again, at what kind of a profit should they make? Well, I would put it this way: the top 7 health insurance companies in America over the last 5 years had a combined increase in their net profits of 170%. The average salary of the CEOs of the top 7 health insurance companies is $14.2 million a year. I'm not certain that that's the kind of money we want taken out of our healthcare system to pay high-priced executives
And
and
how
to pay
much was the
pharmaceutical
airplanes you
companies.
guys got to fly around the country?
Yeah.
You, in your words,
He ain't calling you.
please,
Ask this question.
Yeah, he's
in your introductory words, you said that healthcare costs us $2 trillion a year. I'll take that as true.
Plus.
Plus. The banker bailout bill that you voted for has already cost us $23 trillion. You have enslaved me, my children, my grandchildren, anybody's great-grandchildren here to pay Wall Street bankers. We cannot pay that back.
Senator Harkin.
Yes.
I'm new at this. My name is Diane Robinette. I'm here from Des Moines. I'm a little bit concerned that apparently the statistics in terms of, 46.5 million uninsured, that sounds like a crisis. But actually, I don't think those statistics are accurate. When you go back to the 2005 census, many of those people are illegal aliens. Almost 10 million of them are illegal aliens. And 17 million of those people are self-insured. They're not uninsured. And 10 million of these people are between jobs and would have insurance coverage within 4 months. So I think there's a little
If you have data on that, I would be more than happy to take it.
Pardon me?
If you have some data,
I do.
public information,
Yes,
Senator.
sir.
you give it to me, I'll look at it. I mean, we look at a lot of the statistics and stuff like that. I think that when they say there are 47 million Americans uninsured, you're right that some float in and out. You know, maybe they're insured when they're employed, then they become unemployed, then they're not insured. But I think that the correct way of saying is that at some point during the year, there are about 47 million Americans without some kind of insurance.
Including illegal immigrants.
Not American.
I don't think so. I don't think that includes.
You can't ask if they're legal or not.
We're running out of time.
Oh, running out of time?
By the way, that's another, I just want to respond to this, that's another misinformation that's gotten out there, that somehow these plans will cover illegal aliens. That is absolutely.
Because you can't ask them if they're illegal or not. You cannot, when you go to the doctor, you cannot ask if you are legal or not. That's why we don't know if we're insuring legals.
Section 152, page 50,
But we don't
51.
mandate in our bill.
Non-US citizens.
You cannot
Right
ask
here in
an
your bill.
illegal if he's legal or not.
Well, then that's up to the doctors and the hospitals. I'm
No,
not.
no, that's not
Federal law.
There's a law. You put in a law.
You're making the law. Don't ask.
All I'm saying is,
Some good
that's up to the doctors to decide that. Yes, yes.
I just have one little question. Your bill sounds wonderful.
Yes.
Sounds great.
Yes, what?
How many congressmen, senators, legislatures, how many of those people are going to be on this program?
That's right.
Because we were told to begin with that we were going to have the same coverage as our government leaders. Now, I haven't heard any of them that are willing to give up their insurance, so why not? If it's so wonderful.
Now that may be the most poignant question of the day. Because the health thing, that what I just described for you, well, with that, you know, we don't have the pre-existing thing, but the system that we're setting up with the gateways and exchanges is exactly what we have.
Then we can get rid of yours and you
Why
can
don't
go
you
on
just
ours.
open yours to us?
Or open yours.
Now let me
Right.
explain what we have. The insurance program that I have is the same for any federal worker, same as a postal employee in Des Moines, or someone who works at the federal building in the Farm Service Agency, or a postal employee in California. We're all in this same thing. What does that mean? It means that every year I have an exchange. I have a gateway that I can go to. I have 21 plans that I can pick from. 21 that I can look at. Now, when my kids were little, I had one plan. When they were growing up, I got a different one. Now that they're gone, I have a different one. But I can go there every year and pick and choose, and I know exactly. That's what we're trying to set up here, is a gateway or an exchange. Every health insurance plan will come into that gateway. The only thing that we're saying is that all insurance companies on this gateway, or if they're employer sponsor, must meet certain minimum requirements. One, can't take into account pre-existing conditions. You can't have lifetime caps. You can't drop someone from your policy because they get sick. The only thing you can drop them is if they don't pay their premiums. But what we are saying is exactly the same as what we have for ourselves in Washington. And the plans that I am able to get at, you will have access to the same things.
I want to see that.
Can I just add one?
Yeah.
The only thing I would add is one of the reasons that our health insurance is so cheap is because we got a big pool. We got a lot of.
You'll have a bigger pool if you have us all in there.
That's right, and it'll be cheaper for
We're going
everybody.
to use yours and forget this new one.
I
Yeah,
want you in my pool.
then get rid of, you don't need to have the bill.
Yes, I am. First of all, thank you for.
I'm trying, and a lot of others are trying, to shift a lot of the focus to trying to keep people healthy in this country. If I ask the question of this audience, how many of you would rather be healthy than be sick?
Oh, gosh.
Kind of a dumb question, right? Of course, we all want to
Just
be
like we're
healthy.
idiots.
But then if I ask you, how many of you, when you go to see your doctor, your health professional, really get good information and supportive services for staying healthy and being involved? Few, but most people don't. You go to a doctor, and you get a prescription. You know, we have, I think if I remember right, and this is about round figures, we have about 34 million doctor's visits a year. They write 3.5 billion prescriptions for drugs. I always ask people, when's the last time you went to see a doctor and you didn't get a prescription for a drug? You know? And sometimes, you know, what you really need is you need some help and support in your diet, in your nutrition, to be help to quit smoking.
And if people don't do that, what happens? And if they don't follow what you tell them to do, what happens?
that's their problem, but I want to build.
No, it's our problem.
It is, absolutely. You have to take responsibility or you don't.
Thank you.
I
feel like I'm gonna faint.
I don't want you
Rather
melting
than the
before my
stick,
eyes.
use the carrot. If you do these things, you will get additional benefits. But if you don't do them,
What additional benefits would there be?
that's your own problem if you don't do them.
What would the additional benefits be?
I mean, yeah, see, I was here, now I'm gonna go over here. Oh, no, I was over here, now I gotta go here.
Real quick.
Yes, Senator, I'd just like to make a couple of